Hi everyone, it is already time for quiz 6 of the top 200 drugs. So this week's topic is women's and men's health. So let's go through the medications quickly. So first drug is lamotrigine or brand name Lamictal. It is an anticonvulsant, so treating seizure disorders. However, it has really common use for bipolar disorder as well. The next drug is topiramate or brand name Topomex. It is anticonvulsant as well, used for treating seizure disorders. But another really common use for topiramate is migraine prophylaxis. So I want you to kind of remember the lamotrigine and topiramate. They're anticonvulsants, but then they have other common use. And this is probably a good time to go through other drugs from the previous week's quiz and kind of see what other anticonvulsants we have gone through. So those are going to be probably good questions for the bonus questions. Another thing that I kind of forgot to mention is topiramate also can be used for weight loss. So especially there's a new drug, fairly new drug that came out in the market called Symia, which is a combination of topiramate and another drug called phentermine, which is a medication used for weight loss by itself as well. All right, so next drug is tamsulosin or brand name Flomax. It is alpha 1 blocker used for benign prostate hyperplasia or BPH. I'm going to say BPH from now on. So tamsulosin, something special about this one is it is selective for alpha 1 receptors in the prostate. So alpha 1 receptors are working primarily mediating smooth muscle contraction. So basically, it is contracting smooth muscles. So by blocking this receptor, this drug relax the smooth muscle tone in the prostate. So something good about this drug is it is because it's selective for these receptors just in the prostate. It works. It has much less side effects compared to other non-selective alpha 1 blockers. So this is one of the preferred agents compared to other alpha 1 blockers. So basically, by relaxing the smooth muscle in the prostate and also in the bladder neck, it improves the urine flow and decreases symptoms of a BPH. Finasteride, or brand name Proscar, it is a 5-alpha reductase inhibitor, also used for BPH and can be used for male pattern baldness. So 5-alpha reductase is it is an enzyme that converts testosterone to dihydrotestosterone. You guys don't have to remember this, but by inhibiting this conversion, it helps to reduce the size of prostate. So finasteride and tamsulosins are often used in combination for treating BPH because finasteride works in reducing the size of prostate, whereas tamsulosin doesn't do that. However, finasteride takes a longer time for it to start working, like about 3 to 6 months, whereas tamsulosin start working quickly and really give a good relief of the symptoms. So that's why these two drugs are used in combination. Another thing to note about finasteride, it is pregnancy category X, which means it can cause very serious abnormalities in fetus. So pregnant women should avoid contact with crushed or broken tablets. All right, sildenafil or brand name Viagra, it is a phosphodiesterase 5 enzyme inhibitor. It is a very common drug used for erectile dysfunction. It can be used for pulmonary arterial hypertension as well, but there's a different brand name for that use. Tadalafil or brand name Cialis, another common phosphodiesterase 5 enzyme inhibitor used for ED, pulmonary arterial hypertension, and also has used for BPH. So the one for BPH is a lower strength, but to be used in daily. All right, so next three drugs that we're gonna go over, they're all nicotine replacement therapy. Means we are replacing nicotine for patients who are quitting smoking. So first one, nicotine patch. Its brand name is Nicoderm CQ. So smoking cessation aid for tobacco cessation. Nicotine gum with the brand name Nicorette. It is also smoking cessation aid. And nicotine lozenge with the brand name Comet. It is another smoking cessation aid. So patch is a one that gives constant and consistent release of nicotine throughout the day, whereas nicotine lozenge and gums, they're taken very often throughout the day, like about actually it's taken every 1 to 2 hours for the first 6 weeks of quit attempt. And it gives quick release of nicotine. So patch and gum or patch and lozenge, they are used very often in combination for those patients who are highly dependent on nicotine, so that they can be used in combination. All right, so ceftriaxone, or with the brand name Rocephin, it is a third generation cephalosporin antibiotic. So probably it's a good idea for you to go over other cephalosporins that we went over in the previous weeks. So that can also be a good bonus question, right? So this one is given either intramuscularly, so by it's injection or intravenously. So more often used in hospital setting than outpatient setting. All right, so metronidazole with the brand name Flagyl is another antimicrobial or antibiotic. The most common use for this drug is for treating C. diff, or bacterial vaginosis, or trichomoniasis. So for many kind of like bacterial vaginal infection. All right, valacyclovir, or brand name Veltrex, it is antiviral, which means it is working to kill virus, not bacteria. So valacyclovir is used mostly for herpes zoster, so shingles, or herpes labialis, or cold sores, or it can be also used for genital herpes. So valacyclovir, it is easier for administration compared to acyclovir, which is actually the mother drug of valacyclovir. So it is only taken once or twice a day compared to 3 to 4 times a day administration for acyclovir. All right, fluconazole, or brand name diflucan, it is a azole antifungal. So now this is working to kill fungus, not virus or bacteria like antibiotic and antivirals. So it is used for candidiasis or other fungal infection. So it is really common antifungal medication. Ketoconazole with brand name Nizoral, it is another antifungal. So it says imidazole derivative. So imidazole is actually a part of azole that we just went over for fluconazole. So actually ketoconazole is a first azole-based fungal treatment. And so fluconazole that we just talked about, actually that was developed later with much broader antifungal activity and more improved safety. So ketoconazole, it has much more side effects and toxicity, mainly liver toxicity. So ketoconazole really is not used systemically, which means you don't take it by mouth anymore, really. But it is used topically. So there's some creams, there's shampoo, lotion, things like that. So mainly ketoconazole is just used topically. Miconazole, brand name Vagistat 3. It It is another antifungal in azole group, also used mainly topically. So Vagistat, as the name you can tell, it is a vaginal cream. So it is used for more like vaginal infection. All right, so folic acid, it is a vitamin B9. It is a water soluble vitamin, and it can be used for anemia and prevention of neural tube defects. So it is really important to have enough folic acid in the system while you're pregnant. So this is really main part of the prenatal vitamins, and it also has to be replaced um, for um, for women who are pregnant. All right, so next, 4 drugs are gonna be all oral contraceptive drugs or other forms. So first one, estradiol patch with the brand name Viveldat. It is estrogen derivative. Actually, this one is not contraceptive. I'm sorry. So this one actually is used for estrogen replacement therapy for women who are going through menopause. So this is to treat menopausal symptoms, including vulvar or vaginal atrophy. It can also be used for patients who have hot flash. Ethinyl estradiol and etonogestrel. It is a combination of estrogen and progestin to be used for contraception. So the brand name is NuvaRing. So it is actually a ring that is inserted vaginally. So it is not something that you take by mouth. It is a ring that is inserted inside of the vaginally. All right, so next one is ethinyl estradiol and norgestimate. So it is another estrogen and progestin combination. It is an oral tablet. The brand name is orthotricycline. So it is used for contraception, but it also has FDA approval for acne vulgaris. So you probably heard that we use contraceptive medications for treating acne, especially for women who are adults who have adult onset acne. So this is a one that actually has FDA indication for that. So just notice that ethinyl estradiol is an estrogen and norgestimate is a progestin. Same thing with ethinyl estradiol and etonogestrel. Etonogestrel is a one that is progestin. Alright, so the final one is medroxyprogesterone acetate depot injection. So it has a brand name Depo-Provera. It is an injectable, so it is given intramuscularly, so through your muscle, every 3 months. So it's contraceptive progestin. So remember the other two that we talk about is a combination of estrogen and progestin, whereas this one is just pure progestin. So there's some patients, some people who cannot use estrogen because of some other contraindications. So there are some people who can only do progestin for the method of contraception. So this one, when you give injection, it forms a localized mass called depot. That's why it's called Depo-Provera. So from that depot, it gradually release and consistently throughout a long period of time. That's how it works. So that's all we have this week. So hopefully the video helps you to understand what they are and to help you to memorize them more effectively. So I hope you guys all have a good week in the weekend, and then I'll see you next week. Bye.